my name is Heather Young, and I'm here to perform infant physical assessment. I'm a nurse practitioner, family nurse practitioner student with the University of Phoenix, and I will be performing head to toe physical assessment on this infant. This is my daughter's doll that I'm gonna just pretend is completely undressed. I would start my assessment out by performing a weight, measuring the length from the top of the infant's head down, straightening the legs to the bottom of the feet, and also measuring the OFC, or the circumference of the infant's head, and tracking them on a graph to make sure that the infant's measurements are appropriate for his or her age. I'm going to start my assessment out by inspecting the infant's skin. I'm looking for color. I'm looking for any Mongolian spots, which would be present, or birthmarks, any rashes that the infant may have, and noting any of that on my assessment. Then I'm going to move to the infant's head. I'm going to palpate and inspect for any molding, any overriding sutures that may be present, cap it from the delivery. I'm going to palpate the anterior and posterior fontanelles and inspect the hair and note any changes that I see there. Moving to the infant's face, I'm gonna look for any asymmetry in the face, looking specifically at the infant's eyes, looking for symmetry in the eyes. I'm gonna pretend that I have an ophthalmoscope, then I'm gonna look for the infant's red light reflex. And then I'll move to the infant's nose. I'm gonna look for symmetry in the nose. I'm gonna also press on each nostril to assess for patency of the nostrils. I'm gonna take a look up each nostril for patency. Going to check the infant's ears, look at the external ears, their alignment. This infant's ears are aligned appropriately. Take a look in the infant's ears. Tilting the infant's head to the side and looking at the opposite ear. Also, perform a hearing screening on this infant if it hasn't already been done. I'm gonna use a tongue depressor, look in the infant's mouth, looking at the palate and the uvula, making sure that this infant doesn't have any sort of cleft palate. Next, I'm going to palpate the infant's sternomastoid muscles and the infant's range of motion, looking for any signs of torticollis. And then I will palpate the infant's clavicles, ensuring that there aren't any fractures present. Next, I will inspect the infant's chest, looking for any asymmetry, watching the rise and fall of the chest, making sure it's symmetrical. Palpate the lung sounds of the infant. Also going to listen to the heart sounds. Next, I'm going to palpate the brachial and femoral pulses for the infant. Then I'm going to inspect the infant's abdomen, looking for any obvious deformities or defects. Going to take a peek at the infant's umbilical cord if it's still still present, and then I'm going to palpate the abdomen. Listen for bowel sounds. Then I'm going to inspect the infant's genitalia. I'm going to look for any obvious deformities. I'm going to look if this infant is a male. I'm going to observe and palpate that the testes are descended on both sides. Also going to inspect the anus and make sure that it is patent and that there's no dimples present. Also observing the infant throughout the exam for musculoskeletal movements, making sure that the infant has symmetrical movements. I'm gonna check the hips, checking for any clicking of the hips. Going to turn the infant over, inspect and palpate the infant's spine, looking for any signs of scoliosis. Also going to be checking the infant's reflexes, checking for the plantar reflex. I can stick my pinky finger into the infant's mouth, check for a sucking reflex, and then looking for a grasp reflex from the infant, that the infant grasps my hands. Also checking the startle reflex of the infant as well. And that concludes my infant physical exam.